This is what the demand for a COVID test looks like. A queue of cars more than 3.5 kilometres long at a new private testing facility at Kingston, hours before it opened. Many were turned away.
I'm that frustrated, so frustrated that, I don't know, can I go to work, can I not go to work? I'm stuck.
I lost my job from today.
There's been no preparation for this and it's upsetting.
Tasmania has recorded another 867 cases. 5 people are in hospital with COVID-19 but are being treated for other medical conditions. More than 2,400 tests were done yesterday, but with testing sites struggling to meet demand, the real figures could be much higher.
I would say it could be as many as twice as many people as we're actually diagnosing do actually have the infection.
The fact that we've got case numbers exploding across Tasmania and many now probably undiagnosed is putting more people at risk because it's spreading wildly amongst our community.
Public Health says this wave of COVID could last up to 3 months. 1 in 170 Tasmanians have the virus, mostly aged under 40. That figure is expected to increase to 1 in 50.
Let's keep our head, sensibly work our way through this. I know that over the next few weeks this will get challenging and numbers will rise. Numbers
continue to climb at the state's hospitals. 50 staff members at the Royal Hobart Hospital have COVID-19. There are 5 at the LGH and 1 at the North West Regional Hospital.
We have not had any reports of hospital transmission of COVID. This has been for staff that have experienced community transmission or have been on leave.
We know that people are working double shift. We know that junior doctors are under ridiculous amount of strain to work extra shifts.
There are 15 nursing homes affected by COVID around the state. 13 have a single worker with it and 2 have transmission within. Hospitalisations are predicted to rise.
Roughly 1 in 1,000 cases could end up requiring intensive care. And there will, unfortunately, also be deaths from COVID over the coming months.
Testing at Macquarie Point in Hobart will double from 1,000 tests a day to 2,000. And there are plans to eventually use rapid antigen tests rather than relying on PCR testing. The government has ordered more than 5 million extra RAT tests.
People are lining up for hours to get a PCR test. They're symptomatic and they haven't been able to get RATs tests. So this was the least that the government could do.
Overseas arrivals will no longer have to quarantine for 7 days and exposure sites will no longer be listed, recognising that the virus is likely to be everywhere and impacting on the economy. Crowds were down at the Devonport Cup today.
We'll take a hit financially and we're prepared to do that to keep the event running and to have the racing going.
Vaccinations for 5 to 11-year-olds will begin in a matter of days. 32% of eligible children are booked in so far. But many parents are wondering how the school year will start. With predictions, case numbers will continue to rise as Term 1 begins next month.
We will put in place the appropriate plans to ensure that we have continuity in our schools moving forward.
Another COVID-related challenge to be faced in the coming weeks. Fiona, Blackwood, ABC News.